A third wave of coronavirus infections and slow vaccination are causing widespread anger and worry in Africa. Thousands of protesters took to the streets of South Africa's capital Pretoria to demand a faster vaccine rollout. Infections are rising sharply in the continent's worst-hit country, driven by the highly contagious Delta variant. South Africa is approaching 2 million recorded cases and has already suffered nearly 60,000 deaths. The government has raised the health alert to level 4, the last stage before a total lockdown. All gatherings except funerals are prohibited, schools are shut, and an overnight curfew extended by an hour. President Cyril Ramaphosa justified the measures to battle what he called this devastating wave.
We don't know how long this one will last, but indications are that it could last longer.
The situation has been deteriorating across the continent since mid-May, with the arrival of new vaccine deliveries slowing to a trickle. Less than 1% of the continent's population is fully vaccinated, according to the World Health Organization.
With rapidly rising case numbers and increasing reports of serious illness, the latest surge threatens to be Africa's worst yet. The epidemic is resurging in 12 African countries, and we are closely monitoring rising cases in another 14.
The resurgence is piling pressure on already struggling hospitals, like in Tunisia. Beja is one of 4 regions where a new lockdown is in place.
With 80 beds equipped with an oxygen source, almost the whole hospital has been converted into a COVID ward, including all hospital departments.
Uganda has also been under a new lockdown since mid-June, set to last for 6 weeks. Police patrol the streets of the capital Kampala to enforce restrictions and arrest street vendors. In the Nakasero market, traders sleep on the spot to be able to keep selling. With no other means to make a living, hundreds of people camp out on the concrete. Daily cases have increased in the past 3 weeks from fewer than 100 to more than 1,700, and hospitals are in desperate need of oxygen.
At the moment, I would say we are able to supply according to the demand, because on average of 300 to 400 cylinders a day, all that is coming in, we are able to refill them at least within a maximum of 8 to 12 hours. Before COVID, we could produce maybe like for 40 to 50 cylinders, depending on the demand.
In Uganda, as elsewhere, limited supplies and apathy are behind low vaccination levels. Africa is the world's second least affected continent after Oceania, but health experts warn over future risks if Africans are not vaccinated.